Welcome everybody, and it is a pleasure for me to chair this meeting that is about the developing donation and transplantation activity in the Balkan area and in some nearest regions. As you know, the last years we have experienced an increasing number of patients requiring transplantation coming from that area. At the same time, a great effort to develop in those countries donation and transplantation programs. Today we have a wonderful opportunity to share information on the state of art of donation and transplantation in some countries of the Balkan area. With many of these countries, we have also set bilateral agreements to address the problem of patients awaiting transplantation and to give some support for developing donation programs in those countries. So it is a pleasure for me to introduce you today. I do not want to waste time, so I give the floor to Professor Patrizia Burra, who's chairing this meeting with me. So please, Patrizia. Oh, is Patrizia with us or not?
Yeah, no, she doesn't seem to be with us. This is Paola speaking. I think we can proceed. I think that Patrizia wanted to remind everybody that we need to stick to the timing, because indeed the assigned timing is quite tight. And then I think we can start with the first speaker.
Please, Paola, go on.
Yes, okay. And I have the pleasure to introduce Dr. Andreia Popovich. She is the head of the Transplantation Medicine and Biomedicine Department at the Health Ministry of the Serbian Republic of Bosnia. Please, Andreia, and she's going to describe the setting up of donation programs in her country.
Good day to all. I'm more than happy to be here today and to share with you the challenges in setting up a new donation program that our country is facing with, but also to hear your experience when it comes to establishing a program in the field of transplantation. My name is Andreia Popovich. I'm a medical doctor and head of the Department for Transplantation and Biomedicine within the Ministry of the Health and the Social Welfare of the Republic of Sprska. During this presentation, I will introduce you to general information about Republic of Sprska, legal and ethical aspects and organizational aspects in the field of transplantation. Therefore, please sit comfortably in your chairs and allow me to guide you through this 10-minute presentation. The Dayton Peace Agreement modified the structure of Bosnia and Herzegovina. It creates two entities, as you can see, the Federation of the Republic of Sprska, which has 51% of the territory predominantly inhabited by Bosnians, but also by Bosnian Croats, and the Republic of Sprska, which has 49% of the territory with the majority of Bosnian Serbs, as well as the 𝗃𝗃𝗃𝗲 district here, which is a self-governing unit under the jurisdiction of the state. Number of the population in the Republic of Sprska is 1.3 million. The Republic of Sprska has a centralized structure with its own national assembly, government, and constitutional court. In the Republic of Sprska, authority over the health system is centralized, with the planning, regulation, and management functions held by the Ministry of the Health and Social Welfare in the Banja Luka. We have two laws regarding the transplantation, a law on the transplantation of human organs and a law on transplantation of human tissues and the cells, which are adopted in 2010. Also, we have a set of rule books that more widely regulate transplantation, also adopted in 2010. Laws and rule books are in the line with EU directives and regulations. This year, an action plan was adopted and it defines activities for this and next year. During my presentation, I will talk in more details about action plan itself. When taking human organs from a deceased donor, transplantation can be done not only if there is a written consent given by the donor for the life as an expression of free will to the family medicine doctor, but the consent of the family is also required. In the case of taking human organs from a deceased person who did not give written consent for the life, but we have a knowledge that that person did not explicitly object, the written consent of an adult member of the family is obtained. The person who explicitly refuses to donate organs gives a written statement of non-donation of human organs to the family medicine doctor. That statement is obligatory recorded in a medical record and immediately submitted to the Department for Transplantation and Biomedicine. On this slide, you can see our organizational structure in the field of donation and transplantation. Last year, we established the Department for Transplantation and Biomedicine within the ministry, and it was the first step in setting up a new donation program. The task of the department will be to perform collection, processing, and exchange of data relevant to donation and transplantation, to organize donation and transplantation program and promotion of organ donation, to maintain a database on recipients of human organs and a database of the persons who oppose to donation after death, to keep the register of donors of human organs who have given written consent, and to maintain the waiting list. Transplantation Center is the organizational unit of the University Clinical Center of the Republic of Sprska, and it is situated in Banja Luka. This center is officially authorized for the transplantation and a living donor kidney transplant program, which is now underway. It is planned that in the center, after all conditions are met, organ transplantations from deceased donors will be performed in the near future. Republik Transplant Coordination is nominated last year, and he is also head of the Transplantation Center. This year, we also established HA laboratory within the Institution for Transfusion Medicine of the Republic of Sprska. We also have 9 hospitals in larger cities whose role will be in organ harvesting. Here on this map, you can see our network. You can see these 9 regional hospitals, which are situated in 9 larger cities. Trebinje, Trebinje, Nevesinje, Foča, Istočno Sarajevo, Zvornik, Bijeljina, Doboj, Gradiška, and Prijedor. And you can see University Clinical Center, which is situated in Banja Luka. As you can see, we covered all territory of the Republic of Sprska. We currently have 120 transplanted patients. 98 patients are with a kidney transplant, 7 patients with a heart transplant. These transplantations were a result of a cooperation between University Clinical Center of the Republic of Sprska and Vienna General Hospital. 3 patients with a liver transplant performed in Padova and Udine, and 4 patients with a kidney and pancreas transplant performed in Padova. At the moment, we have approximately 400 patients who need a lung, cornea, pancreas, heart, or a liver transplant. From those 98 patients with a kidney transplant, 31 patients are from living donor kidney transplant program performed in University Clinical Center of the Republic of Sprska. 30 of them in cooperation with transplant team from Military Medical Academy in Belgrade, Serbia, in the period from 2010 to 2017, and one in 2018. And 67 patients are from deceased donor transplant program performed in Russia, Italy, France, India, or even Tuzla, which is a town in Federation of Bosnia and Herzegovina. 30 of 31 living donor kidney transplantation were living related, and one was living unrelated. At the moment, we have 400 patients, potential candidates for kidney transplantation, 25 patients waiting for the transplantation, and 1,205 patients on dialysis. All transplant-related activities have been stopped since 2019 due to COVID-19 epidemic. Here you can see that preemptive kidney transplantation was made in 3 patients, and it was like 10% of all transplantation. 70% were men and 30% were women. The average age of the patient was 34.43. The most common cause of terminal renal failure was chronic glomerulonephritis, and the most common complication after kidney transplantation was infection tract. As I said at the beginning of my presentation, we have adopted an action plan this year. It is a 2-year plan, and you can see activities which are going to be implemented in these 2 years. We have already started with some activities such as revision of laws and rule books. One of the reasons for that is that the laws were adopted in February 2010, and 11 years passed since their enforcement. And the second reason is because the law on human organ transplantation is not quite or totally in line with the directive on standards of quality and safety of the human organs intended for transplantation, as it was adopted before the publication of this directive in July 2010. In May, we will have appointed hospital transplant coordinators, their deputies, transplantation teams, and organ harvesting teams. By the end of the year, we need to devise a campaign to promote organ donation, and we have to do an equipment audit. All these activities will be accompanied by the education of transplantation teams and organ harvesting teams. In the 2022, we are obliged to implement software and to set up a register of human organ donors, a waiting list, and a database on recipients of human organs, and database on persons who oppose the donation of the human organs after death. Then we have to educate our family medicine teams in Dom Zdravlja regarding obtaining written consent and a statement of non-donation of organs. And last but not least, one of the activities should be the implementation of donor cards. So this would be all about setting up a new donation program in the Republic of Sprska. If there are any questions, I will be more than happy to answer them in a Q&A session. Thank you very much.
Thank you, Dr. Popovich. And we have a final part for the question and the answer at the end of this meeting. So please stay with us.
Yeah.
And now I give the floor to the next speaker, that is Dr. Marija Rajkovic, who is the responsible for the donation program in Serbia, directly appointed by the ministry. So Dr. Rajkovic will speak about developing an existing donation program in her country. Please, Marija.
Good evening, everyone. Thank you for joining. My name is Marija Rajkovic. I'm an anesthesiologist, presently working in University Clinical Center of Serbia, and I'm coordinator in the field of organ transplantation in the Ministry of Health in the Republic of Serbia. I have nothing to declare, and feel free to share this presentation on social media. The history of organ transplantation in the Republic of Serbia is actually really long. The first organ that was transplanted in Serbia was transplanted in 1975, continued with, it was kidney, continued with heart, liver, and pancreas organ transplantation until the late 1990s, when that program was stopped, and the transplant program was restarted after the break in 2013. Nowadays, transplantation medicine in the Republic of Serbia is well organized, and we perform cadaveric transplantation of liver, heart, and kidneys, then living donor human organ transplantation of kidneys, and cornea, bone, and skin transplantation as well. The long history of organ transplantation in Serbia resulted in well-organized organ donation and transplantation system, with the competent governmental body responsible for managing all activities related to the system of transplantation, that is Directorate for Biomedicine, and it is the part of Ministry of Health. We have 36 donor hospitals that are established throughout the countries. These are healthcare institutions authorized to perform brain death determination, and every hospital has its own network of transplant coordinators. In Serbia, we're performing immunogenetic and microbiological as well testing, as well as tissue typing in healthcare institutions that are certified by European Federation for Immunogenetics. We have 5 healthcare facilities authorized to perform organ transplantation. There are 5 hospitals. 3 of them are located in the heart of Serbia, in Belgrade, that is capital of Serbia. And one of those 3 hospitals is specialized for transplantation in children. One hospital for organ transplantation is located at the south of Serbia, and one is located at the north of Serbia. Kidney, liver, and heart transplantation programs in Serbia are well developed. In 2018, the law on human organ transplantation was adopted, and with that law, the area of human organ transplantation is systematically fully regulated. It ensured the conditions for achieving the quality and safety standards of human organs for transplantation, and basic principles, working conditions, and ways of organizing the health system in order to ensure optimal sufficiency of organs for transplantations are defined, and high level of human health protection is ensured, with respecting priority interests for life and health and protection of basic human rights and dignity of organ donors and recipients. Organ donation program in the Republic of Serbia is today stronger with the new law on human organ transplantation. Because of this law ensured the list of healthcare institutions that perform organ transplantation activities, organ explantation activities, and list of donor hospitals that are established. Transplantation program that is unique in the territory of Republic of Serbia, and which defines clear procedures regarding the organization, teams, and financing of the entire transplant procedure is defined. Simplification of issuing approvals to health institutions for performing human organ transplantation activities. This law ensured establishment of a single information system in the field of organ transplantation, traceability system, then simplification of the procedure for giving consent for organ transplantation, then adoption of a promotion program that will adequately influence the change of citizens' awareness regarding the organ donation, and this law is in full compliance with European Union directives. The new law applies the model of presumed consent, opt-out system, and still is necessary family consent. What we're so proud on is that new law is fully harmonized with European Union regulations on standards of quality and safety of human organs intended for transplantation, on laying down information procedures for the exchange of human organs intended for transplantation between the member states. Here you can see the chart that represents number of donors and donation rates per million people for the period of 2010 to 2020 in the Republic of Serbia. We can see the numbers are really low, and number of donors is not rising. It's not even constant. We have great variation through the years. And that's our biggest problem that our transplantation system is facing nowadays. Every healthcare institution with an intensive care unit is obliged to establish a system and efficient procedures for donating, that is obtaining human organs of deceased person in accordance with modern medical achievements and the highest professional standards. There are 36 donor hospitals. These are the network of healthcare institutions which, in accordance with the law on human organ transplantation, perform donation, testing, assessment of donors' eligibility, and eligibility of human organs, acquisitions, preservation, transport, allocation, and transplantation of human organs for human treatment. Transplant centers from the National Program for Human Organ Transplantation are faced with lack of human donors. That's our biggest problem, and we need to find a successful and efficient model for increasing the number of donors and to provide self-sufficiently. We have another very big problem. Unfortunately, there is a negative public attitude towards organ transplantation in Serbia, and we need to educate the population about the importance of organ donation. Challenges to our present system are definitely failure to identify potential donors in transplant centers and donor hospitals in Serbia, the lack of specific established protocols and standard operating procedures with clinical parameters in order to facilitate the timely identification of the donor of human organs may be one of the reasons why coordinators in donor hospitals are not reporting potential donors. Then insufficiently precise provision of the law regarding the conditions for donation of human organs from a deceased person may be one of the reasons for the lack of trust among residents. And non-implementation, continuous and comprehensive campaigns aimed to education, motivation, and promotion of human organ transplantation is slowing down the process of making number of donors bigger. We recognize the key role and responsibility of the hospital coordinators in providing the quality of detection of donors and algorithms of referral of possible organ donors. That's why special emphasis should be placed on education and training of healthcare workers who treat patients with devastating brain injuries in intensive care units, emergency departments, neurology, and neurosurgery department. We need to start to educate doctors from medical school and medical students' education on the importance of human organ donation has to be implemented. We need also to educate journalists to report and write on human organ donation. That's why we're aiming to develop adequate and effective public policies to promote donation and transplant programs and extensive cooperation with the media in order to promote organ donation. We need to continue to raise public support and awareness of the importance of organ donation and to try to expand the network of donors hospital. From the beginning of this year, we had one deceased organ donor, but two potential donors did not become donor because family refused to give a consent. That's our second biggest problem, and more reasons why a potential donor does not become a donor are an explicit wish of the deceased and the requirements of the legal system for forensic reasons. Serbia has established a well-organized organ donation and transplantation system. We're facing with a lack of donors, and with strong joint activities of all members of society, primarily the state, the Ministry of Health, other institutions, the healthcare system, the non-governmental sector, religious communities, and each individual, we can lead to the improvement and more efficient transplant system in Serbia, which is a prerequisite for cooperation and international agreements in the field of human organ donation and transplantation. Thank you very much.
Thank you, Marija. I think that now Professor Patrizia Burra is with us. Patrizia? No, Patrizia is not with us.
I'm here. I'm
Okay.
just joining a bit later. Yes. I'm following the presentation. Thank you. If you want to go ahead.
Okay.
Yes. Okay.
So,
then,
Paola, will you please introduce the next speaker?
Yes, sure. And I thank the previous ones because they have stick to the timing perfectly. The next speaker is Dr. Radu Zamfir. He is a surgeon, but he also the director of the National Transplant Agency, the competent authority of Romania. He is going to introduce the topic of how Romania is trying to extend the donor pool. Thank you, Radu.
Thank you very much for the honor to being here, to presenting you our transplant situation, our donation situation. I have nothing to declare, no disclosure and conflict of interest. I will present a little bit of history of Romanian key points in transplant. 1980 was the first kidney transplant from a deceased donor. In 1995 was defined the national protocol for brain-dead criteria. First multi-organ retrieval was done in 1997. First heart transplant was done in 1999. First successful liver transplant from deceased donor was done in 2000. First medullary transplant in 2001. First combined kidney and pancreas transplant was done in 2004. And the National Transplant Agency was established in 2004. I will stop a little to present more or less the centers that are involved in the field of transplant. I have to present first of all the center, the Fundent Clinical Institute with the liver transplant center that I am part of it also. It's the first center of liver transplant. The solution for the scarcity of the donor was also applied new techniques that can improve the availability of the grafts. Some kind of domino technique in liver transplant, split liver in situ, split liver ex situ from brain-dead donors, and also a program of living-related liver transplant with the extreme, let's say, dual graft liver transplant with 2 left lobes. I will go further. Also to present the heart transplant centers, one in Bucharest, one in Târgu Mureș. Also, we got 2 experienced kidney transplant center, 3 in fact, I'm sorry. One in Bucharest, one in Cluj, and one in Iași, with thousands of successfully transplant operation done. Also, we have the 2 centers that are evolving in private medium, in private hospital. One is for kidney transplant. It's in Brașov, and the other one it's in Bucharest for liver transplant. The last one has done already 2 living related liver transplant. I will move forward. The National Transplant Agency is the competent authority subordinated to the Ministry of Health. The purpose of the agency is to monitor transplant activity, and also it's made from one executive director and 6 regional transplant coordinators. The transplant coordinators are spread all around the country in the principal centers from our country. For example, from Bucharest, from Constanța, from Iași, it's in Moldavia, from Mureș, Timișoara, and Cluj. As I presented previously, I advanced the description of the centers. Also, I have to mention, I forgot to mention the lung center that was developed in Bucharest also, lung transplant center. In our lung transplant center, it's in a stage of pioneering of this kind of transplant. It didn't have too much procedure done already, 8 at all. Last year was done only 1. Here I have to make a special remark related to the memorandum that we signed with Italy, with the National Italian Transplant Network. With this occasion, I thank again for, in the name of our patients, for the support from the Italian side, because indeed the patient wait way too much on the waiting list, and they have the progression of the illness, and this memorandum helped them to be transplanted in real time for this illness. Also, we are looking for this Italian support as a safety net for the patient that cannot be operated in our lung transplant center, consecutive to their complexity of the case, or having in mind that our center do not do pediatric lung transplant. I have to mention also that we have 11 tissue and bone transplant center, 4 cornea transplant center, 6 medullary center. In accordance to the legislation, we have some steps. We had some steps following the harmonization with the European Union legislation. Practically, we had the Law 95 from 2006 of health that express exactly the permit of retrieval of organ for medical use. Also, there was a few orders that complete the legal context of the transplant and the donation, and it's the order 1246 from 2012 that make the assigning of the hospital in-house coordination and coordinator and KDP. Consecutive this implementation of this order, we had a good rising in the number of the donors, because having a person that in each hospital, the in-house coordinator and KDP, we have a better perspective of the situation, of the diagnostic of the of those patients, of the donors, and also we've been in touch with them. They was in touch also with the regional coordinator, and that put all things together for a better organized multi-organ retrieval. Also, we have an order from 2014 that revised the criteria of the brain dead, and also this order established the forms for the consent for transplantation and donation, and also for the export and import of organs. We also, as I told you, according to European legislation, we try to make the traceability more exactly. We try to do this from paper to records in computers. We have electronic register, national register of a transplant. We have persons specially implied in the inscription in this register, and also we have one irreproducible code assigned to each patient. This making the traceability more easy to watch and to follow. Also, we move our server that was have inside this register in the health ministry space. So excluding more variability that could influence this register. As I previously told you that as you see in the map from 2012 and in 2030, it was rising in the number of centers of where is done the donation of the organs, and this was observed also in the rising of the number of the transplants.
Radu, I'm sorry, you have just 1 minute left. I'm sorry, but okay.
I'll be short. I'll be short. Okay. We observe here a rising in the donation numbers. Okay. The pandemic influenced negative the donation rate, as I think in all the countries. But we had a recommendation. You can see the same thing on the each organs in 2019, 2020, and the number that we have in this year. The agency, the national agency, make a recommendation for the center, for a transplant center, to keep the activity on as long the benefits are bigger than the risk for the patient. So with this recommendation, we on all this time we had at least one center that do one specific solid organ transplant. As you see, we also send some graft to Eurotransplant. Future objective is including more hospital in the donation program, improving coordinator skills, implementing the pediatric transplant program, implementing the DCD program. We have a design to a pilot study to make to rise the DCD program in 2 centers in Bucharest and Iași. We have perspective of developing composite tissue transplant. We have some specialists that propose to make some hand transplant. We also have specialists that propose us to develop uterus transplant. Also, we have proactive cooperation with the neighbors states. We have a protocol with Moldavia, with the Republic of Moldavia, a protocol that implied exchange of organs and exchange of the experience in the field of transplant. And we are in discussion with the Republic of Bulgaria in the same manner, but probably easier because we are both in European Union. Also, referring to the cooperation with the outside organization, we had some experience with the Eurotransplant, but I think we will try to look to the 𝗱实 platform more than Eurotransplant, and I think this could be a good point for us. Well, we consider Romania part of the Balkans, and also I think we are all immortal, but we must perish first. This is something spoken by one of our writers, 𝗃ощ𝗹𝗂𝗲𝗱. Thank you very much.
Thank you, Radu. Thank you very much. We then proceed quickly to the next speaker. That is Dr. Maya Moysova. She is an experienced anesthesiologist and also transplant coordinator in North Macedonia.
As I said before, I'm Dr. Maya Moysova. I'm an anesthesiologist. I'm also part-time job national transplant coordinator of North Macedonia. I was 2.5 years ago, the government of Macedonia was appointed me as a national transplant coordinator. And as you know, I don't have nothing to declare, okay, and I'm okay with it. I'm okay with social media, and you can share my presentation. So Macedonia is, as you know, a small country, 2 million approximately, but I think that we are less than 2 million because we didn't have census for almost 20 years. So 80% is Orthodox and 20% is Muslim. And the area is 25,713 kilometers. Yes, we have stable transplant programs for kidneys 30 years from before. So in 2013, we had a new law. It was by EU directives, and it was adopted, maybe rewrite or even translated from the Croatian law. And we have at that time only 2 hospital coordinators in clinical center. And by the law, every person is a donor, except the one who declares during the life that he's not. And of course, the family has had the last word. During 2013 and 2018, we have 8 deceased donors and 15 kidneys transplantation, deceased donor transplantation, and 105 living donor transplantation, and they were performed in the University Clinic of Urology in Skopje. So in October 2019, when I started my job, we started the preparation of multi-organ transplantation from deceased donor. And we have new medical protocols on transplantations. And of course, kidney was something that was established 30 years before me. And of course, we started with protocols for heart, liver, bones, and bone tissues. It was a starter. It was October 2019. And as you know, after that, it was everything different. 2020, it was different. So what have we done during this period? We have national waiting list register for kidney, heart, liver, bone, and bone tissues. And we have also a good laboratory for HLA typization, almost 20 years. Ministry of Health and National Transplant Coordinators had the list. And we have on the list 22 candidates for heart transplantation, 110 candidates for kidney transplantation, 21 candidates for liver, and 20 patients for bone and non-tissue transplantation. Every patient on the list have HLA compatibility parameters, and we have also algorithm for matching the patients by the software, and that is something new in our country. We didn't have it until now. So 2019, we have nine donors, but we have 3 consents. We had 3 kidney transplantations. We have 1 more hospital coordinator, so they were 3 hospital coordinators. We had no campaign, but I must say that we were trying to have a weekend with journalists, and I was explaining for 2 days about deceased donor transplantation, about the law, about the brain death concept, and it was exhausting, but I think it was very important to media to educate the media. And so you can see in 2020 we have some success, and for the living donor kidney transplantation. So 2020, as you know, Corona pandemic, after 15th of March, quarantine, when we decided to stop with the transplantation. Of course, at that time we have lack of knowledge about transmission of the virus. But on 23rd of May, a 46-year-old woman with brain trauma was diagnosed and brain dead, and we have consent of the family. So we had big dilemma, I must say. I have a really big dilemma. Is it the right time for the heart transplantation for the first time? And it was the first time. But I think it was a good decision. For the first time, heart transplantation was performed on the University Clinic of Cardiosurgery with medical teams from the 3 cardiosurgery centers in the country, because we have private cardiosurgeries. And by the law, they cannot perform transplantation. The transplantation only can be done in the public health. This is the first recipient of the heart. His name is Ivan. As you know, we know all each other. It's a small country. So after 35 days in the hospital, it was a little bit mismatched with the heart, because it was woman heart, smaller than Ivan. He was in the hospital for 35 days, but he was released at home in good condition. In October 2020, he was diagnosed with corona, and also with no complication. He's really doing fine. I saw him just a few days ago, and now he lives with the family, normal quality life. And also in July 2020, sorry for the mistake, we had 1 donor, but no candidate for the heart. Unfortunately, the most suitable candidate for the heart transplantation, they refused the heart. I don't know why, maybe because of the fear, maybe because of it was the first heart before, and it was really devastating. For me, maybe disappointing, because when you have the consent of the family and they say yes for all the organs, it's very difficult to tell them that nobody wants the heart. Okay, but it was not that disappointing that I wanted to go on. So what we started in 2021 with plans, teaching and training agreement with Eurotransplant, we want that because we need really help. So we have also Erasmus project with ITN for education in the field of transplantation. I must stress out that we have a lot of anesthesiologists. They've been educated in TPM courses in Croatia with a lot of help of Mirela Bušić. During these 8 years, even me, I was 3 times even in Barcelona. So organ donation campaign, you see, we don't have a campaign as a campaign, but after the heart transplantation, it was a huge impact of media, and it was really a good impact. Even the journalists wanted to know everything about organ donation, and it was very, in the social media, it was very crowded with the questions and the changing the law or something like that. Everyone knows better than us, but it was very good for us. And also we increased the hospital coordinators. Now there are 7, And of course, they are educated, even those who are not. We are doing the internal courses. I'm the main educator. Okay, we still want to start the program for liver transplantation. I hope this year maybe we can be successful. I don't know. It depends from the gastroenterologists and of course the abdominal surgeons. I don't think at this time they are very motivated, unlike like cardio surgeons who were very motivated. And of course, starting the program for bone and bone tissue transplantation, as you can see after this slide, and establishing bank of bones and tissues, and that we have done. So what can we say? Plans versus reality. Pandemic with coronavirus transformed most of our hospitals into intensive care and COVID centers. The number of hospitalized patients were higher than ever, and more patients need non-invasive ventilation and mechanical ventilation. So as I can see in every other country, they are struggling with the same problem. So on 15th of April, in ICU, young 21 female was diagnosed with brain death. Beside the COVID situation in the country, we decided to proceed with the donor. We made clinical tests and brain criteria was, and she was declared with brain death. After receiving the confirmation of organ donation, we proceeded the donor, and on 17th April, early in the morning, we started the explantation. After rejection of one young lady, she was suitable for this heart. She didn't want to, she was scared, of course, and the young male, 21-year-old man diagnosed with cardiomyopathy received the heart. 20-year-old and 40-year-old patients with chronic kidney disease received kidneys, and bone grafting for young female 19 years old after chemotherapy for Ewing sarcoma for the proximal femur. It was performed yesterday. So this is me in the operating room, because I'm an anesthesiologist and I want to be there everywhere and to control the whole procedure and the transplantation. This is the explantation. So what can I say at the end? Do we have a system? I think that we start some system. We are not, I can say that maybe we are on the beginning, but I can also say that we are going on the right direction. I think that the path that we are on it, I think that it's going to be the successful year, because I think the citizenship and the media are really into this problem. Do we need help? Of course we need help. We need help on mostly when we have a donor. We don't if we don't use the liver, why someone else not to use it? That's my question. Or something else, maybe even heart, because it's a small country, you cannot find always a suitable recipients. Can we do it alone? At that time we did it alone, but it was really exhausting, and it was really I think, and it was on the eye of the public, and it was really stressful for me. Can we do it better? Yes, I think we can do it always better. And besides of the small number of donors, we are proud for moving forward in this field of transplantation. For illustration, just to tell you, we don't have an agency, we don't have even the real body of National Transplant. The National Transplant Coordinating Body, Ministry of Health, is presented with me as a National Transplant Coordinator, but this is part-time job. And Andreia Popovich, Project Manager, this is us on the picture, you can see it down. And this is after 48 hours not sleeping after the last transplantation and explantation. And this is the press conference, of course. It was performed in front of the cardiosurgery, the clinic of cardiosurgery. So you can see on the right side, it's a Minister of Health, and the others are all participants in the transplantation. So I think that I covered the time, and it's okay. And thank you for your time.
Thank you very much, Dr. Moysova. Now let's go to the last presentation. Let's skip from the donation to the transplantation side on a clinical view. Let me introduce Dr. 𝗃𝗹𝗂𝗲𝗯𝘀𝗲𝗱, who is responsible for the heart transplantation program in Slovenia, and is also in charge for developing similar programs in other Balkan countries. And the topic is challenges and opportunities of building a transplant program, a clinical perspective. Please, Dr. Knežević.
Chairman, ladies and gentlemen, it is my great privilege to be a part of this very important pre-Congress webinar. Are my slides visible?
Yes.
Yes, okay. My name is, thank you for the introduction. My name is Ivan Knežević. I am cardiovascular surgeon and head of the Transplantation Center in Ljubljana, Slovenia. As you may know, we have very strong transplantation activity in our country. Our country is very small, only 2 million inhabitants and only one transplantation center, but we are performing more than 120 organ transplants annually. And from 2012, so for the last 10 years, we have, let's say, the highest number of heart transplants per million population annually on the world. I have to emphasize also extremely good cooperation with Slovenia Transplant, which is a governmentally founded organization. As we heard in a previous talk, I think it is necessary to organize such an agencies to promote, as a liaison, to promote the donors and transplantation activity in countries. So according to our experience, it is extremely complicated and hard to have that. We did that in year 2000. That's also the year we combined our activity with Eurotransplant. So I'm going to move in connection with this presentation. I have nothing to declare as a conflict of interest, and you're really welcome to share details of my presentation. The organization of an organ transplant program is highly dependent on the population's confidence in the program. And why is that? Due to the fact that the regulations, due to the fact it always involves an organ donation by a deceased person or by a living donor. And it is extremely important that the regulations for living donors should be well established, with restrictions to unrelated donors and prohibition of any kind of commerce, also for deceased donors. So, steps. First, establishment of regulations. I'm not going to talk about that. We heard something about that in previous talks. It's different between countries. And then training of health personnel, and also what the public health system has to provide. So the strategy. There are different ways how to start the program, but all the strategies should be implemented almost at the same time. This is included, here are included all strategies and actions intended to enhance the infrastructure and operations of all transplant programs. So extremely important is institution. So it doesn't matter if it's single or multi-organ transplantation, but that should be a strategic priority for the institution. And institution should recognize that transplant is unique compared to other health services. Hospital leaderships should demonstrate a commitment to making transplantation an institutional priority, and due to that, to assure adequate organizational resources to develop a successful program. To develop, and second thing is to develop a leadership match. I said match, not a pair, but match with physician and surgeon. This is a driving force of every transplant activity in hospital. Also, it is necessary to develop a transplant administrator, to have a strategic plan with action plans, goals, objectives, and to track them, and identify resources inside the hospital. Next, very important thing, to demonstrate the clinical, economic, and non-monetary benefits of transplant to the hospital and the community. To the hospital, it is, if you're able to perform good, decent transplant activity, that means the organization, the hospital is well functioning, especially in the country. I mean, this is all the transplant activity in one country, in one hospital, puts everything on another level. This is good also for community. So it is necessary also to support a pro-donation culture through the institution, and also to gain hospital senior leadership, not only the hospital leadership, but also the leaders of as a medical leadership, to prioritize the needs of transplant patients in all operational areas, the ORs, ICUs, and unit beds availability, due to the fact that this is some kind of urgent surgery, urgent procedure. Team. So first, align multidisciplinary team members with a mission and vision. It is necessary to recruit experienced and high-performing surgeons and physicians with a passion for transplant program. At the same time, also to provide a comprehensive onboarding mentorship for new transplant staff, unexperienced, and all the time to educate transplant center staff about innovations and transplant activity on different meetings, webinars, and so on. Clinical operations. It is very important to assess referrals, physicians' needs, and satisfaction on ongoing basis. You have to promote the living donation as an option, and to develop evidence-based evaluation protocols, ensure indications and contraindications. Also, they should be evidence-based, to review candidate selection and waitlist data, and regularly review center and candidate-specific organ acceptance criteria. Patient-centered care. Extremely important to remove any barriers that prevent patient access to transplant program. How? To identify and address cultural, geographic, and communication barriers. Not all countries are the same. Develop end-stage disease care program. It is a very good idea to develop advanced heart failure program, VAD programs, end-stage renal failure program, and in this way to feed transplant services as a part of end-stage disease care. Important to empower patients and families to be involved in decision-making process and also patient care, and provide appropriate education and training to caregivers in the primary language. That means the consent forms and education materials should be written in a 5th to 6th grade level and in non-medical language. Financial structures and funding sources. Very important to count on, to have the overall cost through development and sustainability, to take care of reimbursement of transplant activity, to establish a mechanism to allocate and track costs per organ and phase of transplant in accordance with regulatory guidelines, including living donor costs, to conduct transplant program finance reviews, let's say, on an annual basis. Quality assessment. To implement data-driven continual quality improvement, to report, analyze, and address transplant-related adverse events, to educate team on the process of responding to an adverse event, and usually very good to become a member and share data with some international transplant organizations. And what about the transplant hospital relationships with others? We heard about that in previous talks. First, it is extremely important to support organ and tissue donation as a joint strategic priority, to establish educational relationships with experienced transplant center from the same or any other country, to become a part of teaching and training programs. Those are like twinning agreements and similar. And be, at the end, to be responsible for results and share transparent outcome information. And for the end, my message is establish new transplant program and give our patients a chance to survive. Thank you.
Thank you very much. Thank you very much, Dr. 𝗃𝗍𝗂𝗲. So we have 5 minutes time for a couple of questions. So please, Patrizia, if you like, you can go on with the question.
Yeah, first of all, I would like to thank all the speakers. It's been very interesting to follow your presentation. And I think the first question is come from the first two speakers, to Dr. Andreia Popovich and to Dr. Marija Rajkovic from Danica Spec from Slovenia. So she congratulates to congratulate to both speakers about the organization, about the program of the donor. But then the question is, what are the reasons for the low number of donors after putting such an effort in the progress of donation and procurement in collaboration with Europe and other better developed countries? So this is the question for Dr. Danica Spec from Slovenia. So I think to Dr. Popovic first and to Dr. Rajkovic second answer.
The reason why we are not in Eurotransplant is that we are just one entity within the country of Bosnia and Herzegovina, and it's a difficulty to and I believe that's the problem, that we cannot enter in the network of because we are just entity. We cannot go with that if we are not if we are not enter as a country. So I believe that that's the problem. And we have two separate systems, and we don't have a national transplant center on the state level, and I believe it will never exist, because the health system is divided, and it's the responsibility of these two entities, and that's one of the problem, I believe. And the other problems are political.
Okay.
So I believe I answered to Danica, and hello to Danica.
Yes, yes. And Dr. Rajkovic, what do you think about this comment? What are the reasons why, despite you really presenting in a very nice way, very clear way, all the efforts and the application of you showed in Serbia, the law started in, you showed the official gazette in 2018. So why in 3 years' time you didn't really have what you would like to have in terms of success of the donation?
Thank you for the question. As I said, we have two major problems. One is non-reporting, non-recognition of potential donors. That problem comes from donor hospitals that are located throughout Serbia. Doctors that work there are maybe not well informed or not motivated to cooperate and to report donors. And the second reason is general negative attitude in our country towards organ donation. People are not well educated, they're not well informed, and we definitely need to find a strategy to promote organ donation and transplantation, and to change that negative attitude in our country. We need to educate our young doctors. We need to educate our local coordinators and to make them motivated and make them to recognize and to report donors. We just did everything to make this system work, but we definitely didn't count on that, you know, human factor. And we need to change it in order to have a better transplantation processes.
But you presented a very nice way, all the program, all the idea that you have mainly on education. But have you had the impression that since 2018, let's say, of course, it's a short time, there is something improving? So something that you say your program in education would work at the end? Is your impression, or you have some doubt about the, let's say?
We do not have doubt. We just have a, you know, a pandemic of COVID-19.
Yeah,
we have a general problem,
yeah.
and let me just give you an example. I'm working in 3 hospitals at this time, and I'm doing this job. You know, all of us are just focused on another problem, and that's why this problem was put it on the side. But we will definitely change this. We need to do it. That's our challenge, and we need to overcome that problem.
That's sure. The 2020 COVID didn't help anyone, and actually, to Dr. if I may ask something to Dr. Radu Zamfir, when you discuss about the COVID effect, since Dr. Rajkovic mentioned that, I think it was quite good because for the kidney transplantation that usually are the ones that most had a negative impact from the COVID. At least from your number from 2019-2020, it was less than 20%, which is absolutely the average that we've seen all over in Europe. So I think that was a good data from Romania, I would say, because it was the same everywhere in different countries in Europe. If you want to comment on that, Dr. Radu, Zamfir?
Well, thank you for the appreciation about the numbers in the donors in pandemic time. We try to keep the activity. Despite the reallocation of the resources to the COVID therapies, to there was hospital that moved completely from regular activity to COVID activity. There was hospital that underwent under military structure of and but also, as I told you previously in the presentation, we had the recommendation from beside the presidency to the centers to continue the activity as long as the benefits are bigger than the risk, and so we had in some period from 3 centers, 2 was closed and 1 make all the kidneys that was harvested. So so we didn't you know, the insufficiency of the transplant network, it's converted in the exported organ. It means there was non-patient to be done, non-centers able to done the transplant for those organs. So we have this kind of insufficiency in lungs, also in heart.
Which again, it's understandable. It's not only your experience; it's also another places. So this is different from heart and lung. So.
Yes, but all this in all this pandemic time, we also have struggled to keep the activity, and also despite all the improper condition, we try to make it happen, to make the donation happens. We have also established a transplant commission in every hospital that do the donation, that meets once in a month and analyze the
Yeah, that is very important. That is very important. Because
Yes,
of course that is very important. Thank you. I think we have another question. Maybe this is to Dr. Maya Moysova, since she's an anesthetist. This is the Dr. 𝗃𝗹𝗂𝗲 from University of Barcelona. What about intensive care to facilitate organ donation? Is there any strategy to involve intensive care professionals? I think to Dr. Maya Moysova, to all, but I think I will ask her. What do you think about this comment?
Please, everybody, just a quick answer. If you have already set up education programs for
yes, we have education programs
or not?
Yes, we have education programs, and all intensive care professionals are included in organ donation. So they are mostly educated for brain death criteria, and even maybe not so many speaking with the family. Usually the hospital coordinators are doing the speaking and talking to the family. But all the, maybe not all, but 80% of the intensive care professionals are included in organ donation in my country. Yeah.
So that is already in place. I think if we have the last question to the last speaker, Dr. 𝗃𝗹𝗂𝗲𝗯𝘀𝗲𝗱, I think what is when you stress quite a lot about the multidisciplinarity of your organization. When you talk about multidisciplinarity, which let's say number of professionals and the specialties that are involved in your program? When you talk about the multidisciplinary team, and if it's really, I believe that it is what allow us to work in this way. What is your comment on that?
Yeah, thank you for that question. I wanted to, aim of my presentation is to emphasize the multi-level strategy if you want to build or rebuild or improve the transplant activity. The number of professionals involved in the transplant activity is strongly dependent of the number of organ transplanted. The different organ transplanted. Let's say we started the last organ transplantation was the lung transplantation, which we started in 2018, and now we have really already decent numbers in lung, but we had to start from scratch. So despite the fact that we had the transplantation activity from 1970 in this hospital for the last 50 years, but when we started the lung transplantation program, we started from scratch. So we also identify the proper person for each position, let's say.
Be the best one, yes.
Yeah, for surgeon, physician, and then administrator, and this one and that, and the person before and after. It's very hard to count how many. At the end, you have all the hospital involved in transplantation activity.
Yes.
Let's say due to the fact, especially now in the pandemic situation, when we have at the same time almost closed intensive care facilities, and you have, let's say, the offer for heart or for lung, which you can't refuse, and after that you have to mobilize almost all the hospital facilities to find a place. Yeah, so I think at the end, all the hospital is involved in that. And that's, I think, what I wanted to emphasize at the beginning. Yeah. They need to recognize this is a special program.
Yeah, you have to defend that very much. So I think I would like to thank on behalf also of Dr. Massimo Cardillo, Dr. Paola Di Ciaccio, all the speakers. Have been really very interesting to see the different opinions, different strategies, different organizations, different parts of the Balkans and beyond, as we said. On behalf of PISOT, we would like to thank also all the organizers that made this webinar, pre-Congress webinar. And I would like to remind all of you that we are going to have that fantastic PISOT 2021 in Milan from the 29th of August to the 1st of September this year. And as you can see in the slide. So thank you so much, and congratulations for your presentation once more. And also thanks to the participants and to the ones that posed some questions. Thank you.
Thank you very much.
Thank you very much.
Thank you and goodbye, everybody.
Bye.
Thank you very much.
Bye
Thank
bye.
you. Bye.
Bye-bye.
Bye.